Boardroom Science. Lessons from life sciences and medicine that every leader should apply. Over the course of my career, I've had one foot in life sciences and another one in capital markets. Some of the strongest tools that I apply on a board level come from life sciences and medicine. Let's discuss. 1. The quantum physicist exercise. When I studied quantum physics at the age of 17, something became apparent to me. Forces which act on subatomic world are very different from our macro world. In other words, by simply extrapolating your experience with gravity over here in the macro world, you will be unable to understand the quantum physics world. Simply extrapolating your experience is not enough. Boards fall into the same trap. In fact, many board members are very experienced executives, but frequently in just one niche. And they extrapolate their prior experience on, for instance, the target they're acquiring. But it's not experience, it's a mistake called confirmation bias. Be a quantum physicist. Throw away your experience and see the target clearly for what it is. 2. There is always more than one patient. In medicine, the doctor treats the patient in front of them, but also considers the wider circle, such as the family and society. The same holds true for business. When I see a weak finance function or a weak board, there is a second patient behind. Someone allowed that weakness to persist. Let's take an example of a weak finance function. This is something I see in the most successful healthcare firms. It is frequently the dynamic between founders or the family or broader ownership that scares away the strongest executives. This leads the company with weak leadership and puts a lot of strain on the family itself. This is very subtle because companies I work with are extremely successful. Yet over time, this erodes leadership position of the firm. Find the second patient and you will find the cause. 3. Cognitive psychology belongs in leadership as much as it belongs in medicine. Doctors are trained in cognitive psychology, and the reason is because mental health influences outcomes as much as physical health does. But same applies for leadership. Leaders have to be trained in cognitive psychology in a real way. You need to work with practitioners in cognitive psychology and study the main concepts, not just a workshop. One of the most helpful concepts from the cognitive psychology that I use on a board level of large companies is the concept of unmet needs and how they impact our decision-making. What are unmet needs of your organization? Is the company under pressure because it's experiencing a market share erosion in its medtech division, and therefore you are prone to hasty decisions in M&A? You have to be especially careful with acquiring under pressure and acquiring in different end markets. And it might seem, if you have an unmet need to diversify away from your clients, it might seem that the dynamic is better with a different set of clients, but it's not always true. Study cognitive psychology. Know yourself, know others, and know the terrain in that order, and you will make better decisions.